Welcome to Health Hack. In today's video, we're uncovering the surprising risks that certain medications may pose to your brain health. From memory loss to increased risk of dementia, we'll help you understand which medications could be silently affecting your cognitive function and what you can do about it. Stay tuned. Did you know that certain medications you take every day could increase your risk of severe dementia? That's right. While we often trust our medications to help us, some of them could be putting your brain health at significant risk. It's shocking to think that certain common medications, ones many of us don't even question, are linked to cognitive decline and could potentially lead to dementia. Now, this isn't about scaring you away from modern medicine, which has countless benefits, but rather about making you aware. Knowing the risks associated with these medications and understanding how to manage them could protect your memory. Remember, losing memory or cognitive function isn't an unavoidable part of getting older. Many studies show that with the right precautions and lifestyle choices, you can maintain strong brain health well into your later years. Today on Health Hack, we're diving into 8 common medications that might silently be affecting your cognitive health. Stay with us to make sure you're informed and ready to take action if necessary. 1. Omeprazole, proton pump inhibitor. Omeprazole is widely used to treat conditions like heartburn, acid reflux, and gastric ulcers. It belongs to a class of drugs called proton pump inhibitors, PPIs, which work by reducing the amount of acid your stomach produces. While it's effective, there are serious concerns, particularly with long-term use. Research has raised alarms about the potential effects of long-term omeprazole use on brain health. Studies indicate that prolonged use could be linked to an increased risk of developing dementia. For example, evidence shows that around 10% of individuals using omeprazole may experience memory loss after 3 years of use. This figure rises to an alarming 33% after 4.5 years, with many showing signs of cognitive disturbances. The mechanism behind these concerning effects may involve 2 key factors in brain health: vitamin B12 absorption and the imbalance of gut microbiota. Omeprazole can interfere with the body's ability to absorb vitamin B12, a vital nutrient for nerve function and brain health. Additionally, it may alter the gut microbiota, a factor increasingly recognized for its role in cognitive functions through the gut-brain axis. Given these potential risks, it's important to use omeprazole cautiously, especially if you or someone you know has been on this medication long-term. It might be time to consult with a healthcare professional about reducing the dose or exploring alternative treatments. In some cases, addressing the root causes of heartburn or reflux through lifestyle and dietary changes could reduce or eliminate the need for these medications. 2. Anticholinergics. Anticholinergics are a class of drugs commonly prescribed to treat various conditions, including allergies, depression, and urinary incontinence. These medications work by blocking the action of acetylcholine, a neurotransmitter essential for many functions, such as memory and learning. While these drugs can be effective for managing specific medical conditions, it's crucial to understand their potential risks, especially with long-term use. Studies show that prolonged use of anticholinergic drugs is associated with significant risks to brain health. One of the most concerning findings is that long-term use can increase the risk of developing dementia by as much as 54%. This is especially alarming because acetylcholine plays a vital role not only in daily memory and learning, but also in overall cognitive function as we age. Common examples of anticholinergic drugs include first-generation antihistamines like diphenhydramine, often used to treat allergy symptoms, certain antidepressants such as amitriptyline, and medications like oxybutynin, which is prescribed for urinary incontinence. While these medications can be helpful, they could pose a significant risk if used extensively over a long period. Given these risks, it's important to approach the use of anticholinergic medications with caution. If you or someone you care about is using these medications, especially on a long-term basis, consulting a healthcare provider is advisable. Discussing potential risks and exploring safer alternatives or strategies to minimize their use could be crucial steps. For some conditions, other medications or non-pharmaceutical treatments may be available that don't carry the same risks for cognitive health. It's also important not to abruptly stop any medication without professional guidance. Always consult with a doctor who can help you weigh the benefits and risks, guiding you toward the best treatment options tailored to your health needs. Being informed and proactive about your medication choices is key to maintaining both physical and cognitive health. 3. Corticosteroids. Corticosteroids are powerful medications commonly prescribed to manage conditions such as asthma, allergies, autoimmune diseases, and inflammatory disorders. They work by mimicking the effects of cortisol, a natural hormone produced by the adrenal glands, to suppress inflammation and regulate the immune system. While corticosteroids can be highly effective, their long-term use raises concerns, particularly regarding mental and cognitive health. When used over an extended period, especially in oral form, corticosteroids can lead to several adverse effects on brain function. These include disorientation, confusion, depression, and anxiety. These symptoms can greatly impact daily life, making it difficult to think clearly, make decisions, and manage emotions effectively. The changes corticosteroids cause in the brain are partly due to their effect on cortisol levels. Excessive artificial cortisol from medication can disrupt the natural balance of hormones, potentially damaging neurons in the hippocampus, a critical brain area for memory and learning. The mechanism behind these effects is complex. Cortisol, often called the stress hormone, helps the body respond to stress. However, when its levels are artificially elevated for a long time through medication, it can lead to the degradation of sensitive neural structures and impair the brain's ability to function properly. This degradation can result in memory problems and other cognitive impairments. Given these risks, it's essential for those on long-term corticosteroid therapy to be under close medical supervision. Healthcare professionals can monitor for cognitive and psychological side effects and make necessary adjustments to treatment. This might involve reducing the dosage to the lowest effective level or switching to alternative treatments with fewer risks to brain health. If you or someone you know is on corticosteroids and experiences symptoms like confusion, memory loss, or mood changes, it's important to discuss these concerns with a doctor. Managing the underlying condition while minimizing potential side effects is a delicate balance but crucial for maintaining both physical and mental health. 4. Benzodiazepines. Benzodiazepines are a group of medications commonly prescribed to treat conditions such as anxiety and insomnia. Some well-known examples include alprazolam, diazepam, and lorazepam. These drugs work by calming the nerves and can be very effective in managing severe anxiety and sleep disorders in the short term. However, long-term use carries significant risks, particularly concerning cognitive health. Research suggests that prolonged use of benzodiazepines can double the risk of developing Alzheimer's disease, a severe form of dementia. Additionally, these medications are linked to various neurological symptoms such as memory loss, difficulty concentrating, and disorientation. These effects can severely impair daily functioning and reduce quality of life. The mechanism by which benzodiazepines affect cognitive health involves their impact on neurotransmitters, which are chemicals that help transmit signals in the brain. Specifically, benzodiazepines may disrupt the function of neurotransmitters critical for forming and retrieving memories. Moreover, these drugs can interfere with the sleep cycle, which is essential for memory consolidation, the process where the brain processes and solidifies memories from the day. Disruptions in sleep can therefore lead to poor memory retention and cognitive decline. Given these risks, it's highly advisable to limit the use of benzodiazepines. If you or someone you know has been using these medications long-term, it's important to consult with a healthcare provider about safer alternatives. Cognitive behavioral therapy, CBT, is a non-pharmacological treatment that can effectively manage anxiety and insomnia without the risks associated with benzodiazepines. CBT addresses the underlying causes of anxiety and sleep disturbances, providing long-term relief without the adverse side effects. 5. Amphetamines. Amphetamines are a class of medications primarily used to treat attention deficit hyperactivity disorder, ADHD. These drugs help improve focus, attention, and behavioral control by increasing levels of neurotransmitters such as dopamine and norepinephrine in the brain. While amphetamines can be highly effective in managing ADHD symptoms, there are serious risks associated with their long-term use that need careful consideration. Prolonged use of amphetamines can lead to several adverse effects on cognitive health. Studies show that long-term users may experience memory loss, decreased motivation, and reduced cognitive performance. In some cases, these effects could result in permanent brain damage. These risks are particularly concerning because amphetamines, by boosting neurotransmitter levels, can lead to dependency. This dependency can worsen the negative effects on the brain as the natural production of these neurotransmitters becomes suppressed, making the brain increasingly reliant on the drug. The mechanism behind these cognitive risks involves how amphetamines work in the brain. Initially, they enhance focus and attention by increasing dopamine and norepinephrine levels, which is beneficial in the short term. However, over time, this constant stimulation can lead to neuronal fatigue and potential damage. Essentially, the brain's chemistry becomes altered, reducing its ability to function normally without the drug, leading to long-term cognitive challenges. Given these potential risks, it's crucial to approach amphetamine use with caution. If you or someone you know is using amphetamines to treat ADHD, it's essential to have strict monitoring by healthcare professionals. Regular checkups can help assess the drug's effectiveness and monitor for any cognitive or behavioral changes that could indicate adverse effects. Additionally, considering non-pharmacological alternatives for ADHD treatment can be beneficial. Therapies like cognitive behavioral therapy, behavioral management techniques, and lifestyle changes such as exercise and diet can also significantly improve ADHD symptoms without the risks associated with amphetamine use. 6. First-generation antihistamines. First-generation antihistamines are commonly used to relieve symptoms of allergies and colds. Some well-known examples include chlorpheniramine and diphenhydramine. These drugs work by blocking the action of histamine, a substance in the body that triggers allergic symptoms. While effective for short-term relief, there are significant concerns about their long-term use. One of the serious risks associated with prolonged use of first-generation antihistamines is cognitive impairment, including an increased risk of dementia. This is particularly concerning for older adults or individuals who frequently use these medications. The cognitive risks stem from the anticholinergic effects of these drugs, which block acetylcholine, a neurotransmitter essential for memory and learning. When acetylcholine is blocked, it becomes harder to form new memories and retrieve old ones, contributing to cognitive decline and raising the risk of dementia over time. The way these antihistamines affect the brain involves their strong anticholinergic properties. Since acetylcholine plays a crucial role in various cognitive functions like attention, learning, and memory, blocking this neurotransmitter can impair these functions and lead to long-term deterioration in brain health. Given these risks, it's important to use first-generation antihistamines with caution, particularly for long-term treatment. If you need to manage allergy or cold symptoms over a prolonged period, consult with a healthcare professional. There are safer alternatives available, such as second-generation antihistamines like loratadine, which don't have the same strong anticholinergic effects and are less likely to affect cognitive function. 7. Tricyclic antidepressants, TCAs. Tricyclic antidepressants, TCAs, are a group of medications used to treat depression. Common examples include amitriptyline and nortriptyline. While effective in managing symptoms of depression, particularly when other medications have failed, TCAs pose significant risks to cognitive health when used long-term. One of the major concerns with prolonged TCA use is its impact on memory and overall cognitive function. Research shows that long-term use of these medications is associated with memory loss and a more rapid decline in cognitive abilities, especially among older adults. This decline can affect daily life, making it difficult to remember new information, recall past events, and perform complex tasks that require concentration and focus. The mechanism behind these effects involves the way TCAs interact with neurotransmitters in the brain. While TCAs primarily work by blocking the reuptake of serotonin and norepinephrine to elevate mood, they also block acetylcholine, which is crucial for memory and learning. When acetylcholine is inhibited, cognitive processes are disturbed, leading to memory problems and cognitive decline. Given these risks, it's important to carefully consider the use of tricyclic antidepressants, particularly for long-term treatment. If you are experiencing cognitive side effects or are concerned about potential impacts on your cognitive health, consult your doctor about alternative treatment options. Safer alternatives, such as selective serotonin reuptake inhibitors, SSRIs, like fluoxetine and sertraline, are often recommended because they have a lower risk of affecting cognitive functions. Selective serotonin reuptake inhibitors regulate mood without significantly affecting acetylcholine, making them a safer option for many patients. Statins. Statins are widely prescribed to lower cholesterol levels and prevent cardiovascular diseases like heart attacks and strokes. Due to their effectiveness, they are among the most commonly prescribed drugs worldwide. However, there is ongoing debate about the potential cognitive side effects associated with statin use, particularly regarding cognitive decline. Some research suggests a possible link between statins and cognitive issues like memory loss or confusion, though the evidence is not consistent. While some patients report these symptoms, others do not experience any cognitive side effects, which highlights the variability in individual responses to statin therapy. The potential mechanism behind the cognitive side effects involves how statins work. Statins reduce cholesterol levels by inhibiting an enzyme involved in cholesterol production. While lowering cholesterol is beneficial for heart health, cholesterol is also essential for brain function. Cholesterol plays a critical role in forming connections between nerve cells and maintaining cell membrane integrity. It is hypothesized that by interfering with cholesterol production, statins might inadvertently affect the brain's cholesterol levels, potentially impacting cognitive function. Given these considerations, it's important for individuals taking statins to weigh the cardiovascular benefits against the potential cognitive risks. If you begin experiencing memory problems or other cognitive changes while on statins, it's essential to discuss these symptoms with your doctor. Not all cognitive symptoms are due to statins, and they could be related to other underlying conditions. Regular cognitive monitoring is advisable, especially if you are at risk of cognitive decline. In some cases, adjusting the dose or switching to a different statin may help alleviate symptoms. Alternatively, exploring other cholesterol-lowering strategies might be necessary if cognitive side effects are significant. Conclusion: protecting brain health is critical as it significantly impacts overall well-being. The brain is our most valuable asset, and making informed decisions about the medications we use is essential for maintaining cognitive health. Always consult with healthcare professionals before making changes to your medication regimen. They can help you weigh the benefits and risks and guide you towards safer alternatives if necessary. Additionally, adopting a healthy lifestyle can reduce reliance on medications and help safeguard cognitive health. Remember, staying informed and proactive about your health can make a significant difference. Subscribe to Health Hack for more insightful content on health and wellness, and join us in making well-informed health decisions. Together, let's keep our minds sharp and our bodies healthy.